Hello, we're going to be demonstrating some basic network care, or sometimes we call this level 1 care. Debbie's been in our office for a few weeks and she's developed some of the strategies we'd like to see in people when they're getting this care. So we're looking for dynamic changes in the spine. We're looking for light contacts along the spine to cue the brain to pay attention to itself and to the body, and to start the body to develop strategies to self-heal and self-correct. So initially I'll usually just assess the person at each visit, feeling where they're holding tension in their nervous system, in the muscles, in the bones, and the ligaments. Alright, so we'll often get people to turn their head left and right, look for any changes, see where the body's holding tension, where we need to put in our first input to the nervous system to start the changes to develop. So we're going to get you to look to the right. What we're going to be demonstrating here is what we call a network spinal adjustment, or we like to differentiate it and call it an entrainment. An entrainment is an idea if you take a guitar string, for example, and place it beside another guitar string with the same note. If I pluck this one and it vibrates, this one here will actually start to vibrate in sync with that guitar string. This is called entraining to the rhythm. So what we're looking for, most of the contacts, they're very specific and light contacts that we make. They're usually on the bottom part of the spine and at the top, where your spinal cord is actually anchored into your vertebrae. So what we want to do is entrain the bottom and the top part of the spine to get a pattern going so that we can start to see undulation and a waveform going through the spine. What this does is it suspends the noise that's going on in our nerve system so that the brain can pay attention to where am I holding tension. The body will start to develop strategies to find where it is, bring breath or movement into that area so it can start to release the tension that it's holding. It can start to remodel and restructure the spine to create permanent lasting changes in the person's health so that they'll have better strategies to live their life within their body and when they go outside into a stressful environment. So I'm going to do my first contact, which is, I'll be very, very light, and sometimes people say, well, it almost looks like you're not touching them. Actually, I'm making contact with the people. It's very, very light. I'm going to make a very light contact right down in this area here. And that'll be cueing her brain to pay attention to this area. And we just want to see how her body reacts when I do this contact. Okay, so she's developed the strategies, her brain is paying attention to where her body's holding the tension, and she's starting to move like this. Now if I told her to stop, she could stop. She's doing this, it's coming naturally to her, she's just feeling what she needs to do and going with the sensation. I almost consider this an unwinding, if you would like, of the tension that's been held into the person's system for quite some time. So she did a pretty good session there of controlling that. In our network care, we have a number of tables in the room, and it's not group therapy. What the idea is, after I do that contact, her body actually has to work on that information. Her brain is paying attention, and there's work that her body is doing. So in the meantime, instead of me just sitting here watching, I could start on the next person, get them in their rhythm, work a few tables, and then come back to this person after they've worked on their own body for a little while. So often, that idea of entrainment can actually work with inside the room itself. If this person has a good breath, some good relaxation, the rhythm of this person can actually help the other person get into a good rhythm of breathing and relaxation as well. At the beginning, we want to help the body go through a learning curve of paying attention to itself. So I want to actually address this area of her spine right here. But I'm going to do it through this part of her spine. So I want her brain to be able to pay attention here, make the connection between this and that, and then see that her body can put the two together and make that connection neurologically and through respiration and movement. So I'm going to do a light contact right down here. So once again, I want her brain to be paying attention right there, and I want to see what things happen in that area and see if the brain can connect. Now she's been coming in just for a few weeks, and she's got these strategies very well developed. And not everyone has to move as much as she does, and it's not really that important how much movement, it's important the quality of the movement, because some people will move very, very little on the table, but they'll actually notice pretty big changes within their body and will notice big changes in their tension. A lot of muscular effort, her brain is paying attention, her body's actually working the spine right from the inside to make positive, creative changes from the inside. We'll also see elongation of the spine, and you can see it down here. Very often people are moving their feet like this. So what we're thinking that is inside, the spinal cord is actually getting freer, and that kind of movement helps the spinal cord actually become more free through the activity. The body works on different things, and then it's followed by a breath. It's clear where we actually address the spine, we call those gateways. And so I almost, to explain it, I almost think like there's different ways. A gateway is where the spine is working properly, the nerve system is free to accept an input. And I almost think of it like a doorway. So if the door is open, it'll be inviting for me, and I can put an input into that area, and the body will be willing to accept an input and take that as a creative input for the spine to remodel and do its changes. Here, so I'm going to do a contact here and here. At the fifth level here, and right down at the very bottom, we call it the coccyx at the bottom. What I'd like to see is this area here actually starting to lift a little bit. Okay, so I want her brain to pay attention, lifting that area there, and the spine go through this range of motion to free up a lot of tension. So very often people ask me when they see this care, they say, well, how can that little touch help me because I've got such a bad problem? I got like a massive disc, or I can barely bend, or my problem is so severe. And I want people to get the concept that it's not that contact, the lightness of the contact, that's making, quote unquote, fixing you. It's how your body responds to that, because as you can see, her body is responding to the light contact. So it's not what I do, it's how your body responds to it is what really makes the big changes in people's spines, the nervous system, and in their health. Because what happens is when people have these strategies for their spine, they're much more aware of where they hold tension, even when they're not in the office. And they'll find that when they're in their daily life, it'll become natural that they'll kind of reposition themselves, breathe into things, they'll notice themselves breathing better, moving around and releasing their own tension. So that's why these are sustainable kind of changes over time, because the body itself has made those kind of corrections. So she has very little tension now when I open and close the legs. There's very little resistance in the feet. So the tension patterns that she had at the beginning have really released, so her body has done a great job for this visit. Okay, so that's pretty typical of an initial visit. It can take anywhere from 5 to 10, sometimes up to 15 minutes, but usually it's in the 5 to 10 minute range, to get her body to do a little bit of work, and each visit will build on the previous one. So this is, I think of it like your body learning a new strategy. You're going to the gym, learning how to work out, getting a better body. It takes time and repetition, and when the body does this, it actually develops these strategies, and people can have really dramatic changes.